This presentation is on coronavirus, self-awareness, and safety guide. You will learn information gathered from those who have been affected by COVID-19, along with helping others with a focus on urban youth coping skills with anxiety during this pandemic. What is COVID-19? COVID-19 is a respiratory illness that can spread from person to person worldwide. COVID-19 has resulted in thousands of infections, causing illness and, in some cases, death. Cases have spread to countries throughout the world, with more cases reported daily. But don't you fear, Coronavirus Prevention Guy is here. Of course, it is in your best interest not to panic and to practice these 7 steps to prevent the sites of the virus and to protect you, your family, colleagues, and anyone nearby. Step 1. Wash your hands. I know it sounds ridiculous because who doesn't do this, right? But wash your hands for at least 60 seconds and do so more than the usual times a day. If no sink is around, use hand sanitizer with at least 60% of alcohol. Step 2. We all know how great you look, and however, you must, as much as possible, avoid touching your eyes, nose, and mouth, with those being the common entry points of the virus. And to my hokey pokey lovers, ears, head, shoulders, knees, and toes. Step 3. Clean, 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 clean as much as you can, but be sure to use disinfectants. Either spray or wipes will do the trick. Step 4. No more hugs, high fives, or even fist bumps. Be sure to effectively use social distancing and wash your hands if you come in contact with doorknobs, light switches, computers, and fellow staff members. Step 5. Better chance at fighting the virus if you have and keep a healthy immune system, sleep schedule, eating nutrients, exercise, and de-stress. Step 6. Spring break, honeymoons, vacation away from the kids, all needs to be canceled. Please avoid all non-essential travels. Try and consider alternative ways to communicate, such as video conferencing and virtual collaboration tools. And most importantly, work from home. I repeat, work from home. Now, let's sign into talking about the youth that are stuck in their house with their families and how they can have problems that may be exacerbated by their temporary confinement. It is important to know that there are things that you should not do. It's a good idea to put in check what we are going to do that we shouldn't while isolated. According to medical doctor John Sharp, it's best to understand that during this stage of time, there's a big difference with social distancing than emotional distancing. You are separated from the outside world, but you are not in this alone. Social distance. Don't emotion distance. Anxiety creates many feelings, fear being one of them. COVID-19 requires physical distance for health and safety. Emotional distance detaches you from those support systems you need in order to fight in these harsh times. Anxiety is a constant feeling of many things. Feeling anxious can look and feel like so many things to so many people. The feeling of constant worry, fear, and judgment, not being good enough, freaking out, or even the inability to calm down in any situation. There is a high prevalence of anxiety in urban areas. Amongst the pandemic, creating new anxiety, there's already anxiety in children, youth, and families because urbanization influences emotional wellness through the impact of expanded stressors and factors. There's many symptoms of feeling anxious, and they are but not limited to overthinking, nausea, constant fear, and restlessness. Talking with fellow colleagues who range from little to severe anxiety expressed to me how they deal with their anxiety. The most common one was expressing to their support systems that the biggest no-no was being told to relax, that letting them go through their thoughts and feelings with guidance is the best de-stressors. You have a loved one who's showing symptoms? What does one do? If you're trying to de-stress their situation, you must redirect their situation by helping them reframe their feelings and helping them see that what they're feeling is real but temporary, and comfort them. Now, if you're experiencing any COVID-19 symptoms, please, again, do not panic. Call your local emergency health service hotline. Feeling more anxious than usual? Do you have access to Wi-Fi? Great! Use this link to search for ways to see what is your next step. Being aware is the key to prevention. Just remember, whether it's COVID or anxiety, we are all in this together. You are not alone. I am reaching out to those in need as a Morgan State first-year grad student and aspiring social worker with a specification in urban children, youth, and families. Stay safe.